What if everything you knew about Alzheimer's disease was wrong? Hi, I'm Jonathan Landsman, host of Natural Health 365 and creator of the Alzheimer's and Dementia Summit. And today I'm with Dr. Thomas Lewis, one of the featured speakers in this event. Dr. Lewis, welcome.
Thank you, Jonathan. A pleasure to be here.
Dr. Lewis, talk to us about what you feel is the biggest myth when it comes to Alzheimer's disease.
Well, the biggest myth and misconception is that Alzheimer's is a disease of the brain only, and it's caused by amyloid plaque buildup in the brain. The problem we have is that essentially all the research in drug development has been focused on this amyloid hypothesis. But here's some facts. Some people who die from Alzheimer's disease, when we do autopsy on their brain, do not have any plaques. Whereas some people who live to a ripe old age and die with absolutely no cognitive impairment actually have the so-called Alzheimer's amyloid plaques. So how can the plaque be the only cause of the disease? Now recently, Harvard Medical School has published a study where they looked at the amyloid plaques and shown that it is actually part of an immune response and may in fact be protecting our brains.
So why is there such a focus, though, on just the plaque?
Well, there's actually plenty of literature and research on ideas opposing the plaque theory, but recently they've been largely shut down. One example is Dr. Campbell, who is an Alzheimer's researcher, who published a very interesting study over a dozen years ago, and it was titled Amyloid, Friend or Foe? This paper was extremely balanced. It looked at both sides of the equation. Is amyloid the cause, or is it friendly? And so a dozen years have passed, and there have been no follow-on papers from Dr. Campbell. I called her up and said, why haven't you pursued this line of research? And she gave me a simple answer. There's no funding available for views opposing the amyloid hypothesis. So let's look at the other side of the coin. The NIH has recently funded, in the last couple of years, put $100 million into Alzheimer's research, mainly focused on amyloid. Harvard Medical School got $55 million of that money. So we're not learning anything outside of the amyloid theory. Here's the conundrum we have. We have doctors trying to effectively treat Alzheimer's patients, and we have researchers doing studies. Medical research now is an independent $50 billion business. It's big business. And in the center, we have the pharmaceutical companies. They are funding the research. They are driving the bus. They are funding what they want, and what they want are business ideas and profit centers, and they're funding the amyloid hypothesis. So let's see how it's worked out. Over the last 10 years, all the big companies, Glaxo, Johnson & Johnson, Pfizer, have done trials on real sufferers with their amyloid drugs. How has it worked out? In Alzheimer's patients, abject complete failure. Backing up to mild cognitive impairment, same drugs, amyloid theory, abject complete failure. Where are we now? The drug companies are recruiting perfectly healthy people, no signs of cognitive impairment, and they're going to use these same drugs. What they're saying is we, the pharmaceutical drug industry, have no solution for Alzheimer's disease.
Dr. Lewis, this is clearly much more than a plaque issue. What do you see as the solution?
It all starts and centers around our immune system. All the pundits, all the experts will recognize and appreciate that Alzheimer's is a multifactorial disease. And at the center of all these factors is inflammation. But we have to look at inflammation for what it really is. It's a sign and signal that our immune system is activated and working on our behalf to keep us healthy. And by the way, the inflammation we're detecting is in our whole body, not just in our brain. So what are some of these factors that lead to inflammation and our immune system being activated? It's toxicity, it's stress, it's poor nutrition that doesn't support good immune health, it's lack of sleep, and it's infection, just to name a few. So in our clinics, for example, which we've been running for over 20 years, we see patients coming in with mild cognitive impairment, dementia, and Alzheimer's, and none of them march in are completely robust and healthy and just happen to have this brain disease, this brain affliction. They have a sick brain in a sick body. And some of these overlapping conditions are like cardiovascular disease, metabolic diseases like diabetes, and even eye diseases, glaucoma and macular disease. The solution to Alzheimer's disease is to develop an understanding of what the underlying causes is for all these diseases, including Alzheimer's.
This is exactly why I created this event, so that you can understand how to prevent, slow down, and even reverse the signs of Alzheimer's disease. I hope you get a chance to watch as many of these presentations as possible. I know you won't be disappointed. I look forward to speaking to you again soon. Take care.